we've seen the crisis on an annual basis grow, really from around 2012. And the rate of growth of this crisis has been consistent to the point that it's never been worse than it is right now. I think sometimes people think it's the same as it was 9 years ago, and it's not even close to being the same as it was. I mean, so the first year I was here in 2010, we saw about 167 kids with psychiatric emergencies. You fast forward to this past fiscal year, it's now a little over 4,700. COVID alone, all these things have pushed us into a more and more challenging situation. I think really early on, Rady Children's Hospital saw that, we can't do this alone. The folks over at STCC really interested in having an impact in the community. And us here at Rady, same thing. I mean, our missions are so aligned in that way that I think this was just a natural collaboration and partnership to begin with. One of the really incredible things is partnering on the intensive outpatient program for kids on Medi-Cal. So what we did is really try to think about, okay, there's kids that are in our inpatient unit that when they get discharged, a lot of times we're being discharged to once a week or once a month therapy. So you go from 24 hours a day being supervised and observed in the inpatient unit to once a week, maybe an hour a week, or even less, an hour a month. And so we talked about this idea of, could we find a way to pilot a program where intensive outpatient services, several hours a day, multiple hours a week, where kids could get that sort of support to sort of bridge them back to their life and things as usual. So we did that, and the data was really incredible. It was like these kids were avoiding going back to the emergency room. They were flourishing and going in a positive direction, not needing to come back to the inpatient unit. And so that was just incredibly exciting.
So the IOP program was a game changer for us. Prior to being enrolled in it, we had several attempts at trying to work with Aubrey to get her mental health under control. We were already in therapy. We had already tried medication. We had a couple ER visits for suicidal ideation, and so we were just at a point where we were stuck. We didn't know what else to do for her. Honestly, before we found the program, our plan was to have her hospitalized, but then the social worker at the hospital recommended this program, and it totally changed Aubrey's life for the better.
At the end of the IOP, I had been able to actually speak to people and communicate and tell them what I'm feeling and if I need help. And yeah, I'm really grateful for this program.
I think now more than ever, these major organizations in San Diego that are focused on families and young people in our community, we've got to come together, because I think this is the challenge. This is a generational challenge, is how do we continue to have young people thrive psychologically and have that psychological strength so that they can become adults that are able to manage the stresses of daily life, be a productive member of society. And so I think that's really the opportunity here, is strengthening these types of relationships here in our community to ensure that the next generation is successful and thriving.